Brain cancer is the second most common type of cancer in children. The most common type is leukemia, and we usually think of leukemia as terrible, but in fact, over the 40 years that I've practiced, it's gone from being an incurable disease, or only rarely curable, to the fact that in 2016, the cure rate for childhood acute lymphoblastic leukemia, the most common type, is over 95%. So we've made phenomenal progress in that regard. Unfortunately, the second most common brain cancer, first of all, it's not just one disease. There are many different types of brain cancers, but our progress has been much more slow. And what that means is that brain cancer is now not only the major cause of cancer-related death in children, but in fact in North America, Europe, in the developed countries of the world, the so-called developed countries of the world, after accidents, suicides, and homicides put together, brain cancer then becomes the major cause of death for children between 1 and 19 years of age. Now, a lot of these malignant, what we call high grade or malignant, the nastiest of these brain tumors, which represents about almost half of all brain tumors in children, tend to occur in the youngest of children, in children under 5, 6 years of age. And it was in those children particularly that we realized that even if we can help them and even cure small numbers of them with radiation therapy, the price of cure, because radiation therapy affects normal brain growth as well as the cancerous growth. And unfortunately, the younger you are, the worse it is. So we're not talking about children under 3, 4 years of age who get some mild problems at school, a little bit of problems with math or a bit of reading problems. We're talking about substantially damaged by the radiation therapy so that they're not able to function in not only the school place, but independently in society. So we started what was called the first Head Start study back in 1990, 1991. Here we are, 26 years later. We've conducted serially, one after the other, 3 Head Start trials of intensive chemotherapy with the intent of avoiding radiation, predominantly for these children under 6 years of age with various malignant brain tumors. This has not been done at a single institution. These have actually been multi-center and indeed multinational studies. We've learned a lot through the process, and what we've learned is that in fact for a number of these children, we have in fact been able to cure them, improve their cure rates, and indeed improve the quality of their survival through very carefully, meticulously documented long-term follow-up studies of their intellectual functioning. I came here in 2014 with a goal of setting up the 4th study, which takes really these previous 3 studies quite significantly further, because now we have learned in the recent decade a lot about the biology of certain of these tumors. And the most common one is a tumor called medulloblastoma. And we've learned that there are actually not just one disease, there's at least 4 different types, and we can characterize them with fancy new molecular biologic studies, and they have different prognoses. And we're actually going to be tailoring the therapy in this Head Start 4 study based on whether they fit into a better risk molecular profile group or a poorer risk molecular profile group. This has not been done before for this cohort of children. The part of the treatment that allows us to avoid radiation therapy is where we give what's called a bone marrow transplant. It's like giving a year's worth of therapy in 6 days, I tell the parents. This is extremely intensive chemotherapy. We've been doing that as part of the Head Start study for many years now, doing a single cycle after an initial period of about 3 to 4 months of treatment, when we get them into what we call a remission, when we've got rid of the disease as best as we can see it. Well, what we're asking in Head Start 4 is actually the question whether for those children that we've molecularly defined as being in the poorer risk group, can we in fact do better by not just giving a single cycle, but actually giving 3 slightly smaller cycles so that overall they get, actually it would be twice as intensive therapy over the longer period of time. Well, the grant that we've really thrilled to have been awarded by the Pediatric Cancer Research Foundation is very much related to this protocol, the Head Start protocol. In fact, I should point out that it's probably around 9 years ago that the Pediatric Cancer Research Foundation actually funded a component of the 3rd Head Start study, which has led us to this point of knowledge that allows us to move on to the next stage. On this occasion, our proposal, which they have accepted, is to fund some more advanced molecular biology studies, laboratory-based studies. You will hear more and more in the literature, people like to talk about liquid biopsies, where we take a sample of blood or the cerebrospinal fluid when it comes to the brain and look at whether it's proteins or markers, as we call them, to make diagnoses, but also to follow how well we're doing. These proteins that we're looking at are called exosomes, tiny microscopic globules of protein that float. They're called exosomal microRNAs. And we are evaluating those and studying those. Some of them seem to be particular for some of those distinct subtypes of medulloblastoma. What we want to do is see if the disappearance of those tumor-related microRNAs can predict how well somebody's going to do. And for those that don't clear, maybe those are the ones that we're not going to get away without radiation or need some other different therapies. Bear in mind, again, that this is not a clinical trial that's being conducted at one institution in California and one institution in Ohio. In fact, there are around 40 institutions throughout North America and indeed beyond in Europe and Australia and New Zealand and South America who are going to be participating in this. So children really everywhere are hopefully going to participate in this trial and in the studies that we are doing.